pregnancy related. With a baby growing inside you, there is a huge transformation happening in the way you think, you feel, and you react. In simple terms, this is called a cognitive triangle. Three angles, the three corners of the cognitive triangle are the thinking, thoughts part, the feelings, emotions part, and the reaction, the behavior part. Now, within this cognitive triangle, we do find loads of causes of stress also. Now, let's come to the first part, which is the thoughts part, and try to understand what are happening to our thoughts. Now, our thoughts are internalizing here. As we step into the first part of our pregnancy, the first trimester, we are trying to disconnect from the world and, kind of trying to internalize into ourselves, thinking more about how we are feeling, what are we going through. And naturally, this should happen because if it doesn't happen, that might be the reason you're stressed, or it may kind of lead to further stress. So the thoughts part, since they're internalizing, there's a natural self-regulation happening, a lot of self-love and self-care which is happening. And that's the best part of the first trimester. And as you go along, you kind of get into the second part of the cognitive triangle, which is the feelings part. Now, as you go through, kind of your whole pregnancy stage, the body is going through a lot of changes. There are hormonal changes, there are physical appearance changes, your skin texture is changing, your complexion is changing, the hair is shining or the hair is falling, you're gaining weight or you're losing weight, and even the way your blood is pumped into your heart is changing. So being and and going through these changes makes you very delicate when it comes to feelings and to emotions. And now coming to the third part of the cognitive triangle, which is the reaction part, the behavior part. Now, because of all these different transitions which are happening in your thoughts and feelings, your reactions have also changed. Sometimes, when you don't care for something, you suddenly start caring for them, and when sometimes that you have to do something, you start feeling annoyed with it. So there is a lot of imbalance, a lot of mood swings which are happening, and your reactions are with sudden outbursts, anger, and teary episodes. And that's how the entire cognitive triangle spans out in your pregnancy. And this is where you have to make sure that the natural process is driven with a lot of changes going on in your body, in your mind, in your thoughts, in your feelings, and then also see how those external experiences are affecting you.